Hello and welcome to Deb's Digest. This is the second video I'm recording today from my bed as I rest from the effects of something that's going on. I went to the dentist yesterday and I have been for the last 20 years very vigilant in my dental health. And this started 10 years before I was diagnosed with celiac disease. It seemed as if the back of my mouth was just crumbling. I have several crowns. A couple of them you can't see because they're tooth colored. But from 2002 to 2012, it just seemed like my teeth were just falling to pieces. And no cavities, just cracking. And I know a lot of that might happen to have to do with what kind of dental procedures they did when I was a little kid. But that's not the only problem I've had. And I'm now on a 4-month cleaning schedule because I tend to develop very easily periodontal disease. Periodontal disease. Anyway, gum disease. There we go. And my gums bleed very easily and they infect very easily. And I do have 4 or 5 ancestors that ended up with false teeth. So I am very, very careful with my dental health. And yesterday I went to the dentist and let me go get my toothbrush. I'll show you my toothbrush because I think that this is probably the best toothbrush ever invented. And yes, since I got this toothbrush, well, here's my husband's. I just bought him a new one. I'm not a sponsor of this company, but I love this company. Dr. Plotka's. Dr. Plotka, Plotka, Dr. Plotka's mouth watchers. Soft flossing bristles. Do you see those bristles? They're very fine. And they're also silver infused, so your toothbrush doesn't get it's antimicrobial naturally. I don't know if you can read that, it's mirrored. So antimicrobial. So I brush with this toothbrush and I floss and I brush, more than 2 minutes and I floss constantly. Sometimes once a day, many times, twice a day, depending on how my gums are feeling. A lot of times they'll get inflamed and I'll think that I have something in between my teeth, so then I'm flossing. So, and then I also have a water pick, but I haven't used it for over a month because I was decluttering my bathroom counter and I put it underneath and then I got out of the habit. But that's my routine. And I went to the dentist yesterday and got the very best report on my teeth that I've ever had in my life. She virtually could not find any plaque or tartar on my teeth except for right there where I don't reach very well. She says, this is the only place, and that's the place that's the hardest to reach, so I can understand that you've got some plaque there. No tartar, just a little plaque right in that one section. And she said, this is the mysterious thing. Your gums are bleeding like crazy, even though I can't find any plaque or tartar. And I said, yes, that is me. That is why I'm on the 4-month schedule, because my gums are always very inflamed. And I said, I think it's the celiac disease. I said, also, my blood is very thin because I'm taking a lot of supplements that thin your blood. I said, could it be that? And she said, yeah, I think so. But I also know that I get these bacterial infections if I don't keep my myself on this 4-month schedule. I'm hoping to get back to 6-month schedule once I figure out what's going on. But anyway, that's me. That my routine as a celiac. I have to keep on my dental health, and as long as I do, I don't wake up in the middle of the night with gum pain. I don't have emergency visits to the dentist, and I feel like my teeth are in really, really good shape now. I haven't had to have any cavities or crowns or root canals in 4 years now, almost 4 years now, which is a record for me. So it's working. But in my last video, I read to you from the book called, that's backwards, obviously, but Celiac Disease, A Hidden Epidemic by Peter H. Green, MD, and Rory Jones. And I happened upon this section while I was recording my other video about dental enamel defects in relation to celiac disease. And being that this is Deb's Digest, let's talk about our teeth, right? Let's talk about celiacs in relationship to our dental health. And if we can prevent having to have dental issues. Let me just stop here for a minute. There is a substance in our body called nitric oxide. And nitric oxide keeps our arteries nice and supple so that when the bad fats go through our arteries, they don't actually latch on to the bad fats. But most people, we don't know how our arteries really are. So we should keep the bad fats out all the time. But the epithelial cells of our heart needs this nitric oxide. And when you're middle-aged, the only way to get nitric oxide that actually works in keeping your epithelial cells healthy in your arteries is to chew your food very well and to eat a lot of greens. And chew those greens very well. And people that I know personally that don't chew their food well and don't eat a lot of greens have heart issues, have cardiovascular issues. So this to me is the single most reason why I want to keep my teeth healthy. It's because I need my teeth to be able to chew my food into a liquid, mix in with the enzymes that create nitric oxide to keep my heart healthy. So, I thought it would be interesting to read this short passage here from this book about celiac disease and dental enamel defects, and it addresses other issues that we can discuss in a minute. Dental enamel defects are common in patients with celiac disease. This is very common. They consist of imperfections in the teeth affecting the enamel or outer surface of the tooth. They may manifest as white or brown spots on the tooth or in severe forms, ridges and malformed teeth. Luckily, I haven't had any of that, but I wasn't diagnosed with celiac disease until my middle ages, so I don't feel like the gene expressed itself until I had gone into my middle ages. The defects are symmetrical and bilateral, found on both sides. Several studies from Europe indicate that patients with celiac disease have higher incidence of dental enamel defects than non-celiacs. My daughter, who has not officially been diagnosed with celiac disease, does have dental enamel defects, and she cannot tolerate gluten. So that's an interesting connection. The damage to the teeth occurs if celiac... My grandpa had dental enamel defects too, and he had stomach issues and other issues that sounded like that. Okay, anyway, sound like celiac disease. The damage to teeth occurs if celiac disease is present as the damage to the teeth occurs if celiac disease is present as the teeth are forming. Patients often have teeth laminated or capped because of the imperfect appearing teeth, covering up what may be an indication of celiac disease. Dr. Theologos Ted Malahias, DDS, a dentist studying these defects with us, feels that they are another piece of the puzzle. He explains that the mouth is the mirror of your health. And that's what I was trying to tell my hygienist yesterday. Alphus ulcers, canker sores. Okay, I had a canker sore over the weekend. I have them frequently. I always know that I've been glutened when I get a canker sore. I don't have them near to the frequency that I did before I was diagnosed. I've always had them throughout my life, frequently. The frequency has gone way down, and I usually only get a canker sore if I've gone out to eat. Anyway, alphus ulcers, canker sores, whose frequency of occurrence decreases with the start of the gluten-free diet, my experience, may also be an indication of celiac disease. Nutritional deficiencies or I knew I was going to have trouble with this word. Immunological, you can't read it. Anyway, immunological, there we go, processes during infancy, such as celiac disease, infections in childhood, such as chickenpox, scarlet fever, and rubella, and excess fluoride while the teeth are forming can also cause enamel defects. A patient diagnosed with celiac disease should look for dental enamel defects and frequent alphus ulcers in first and second degree relatives, especially those who appear to be asymptomatic. Because of the risk of gluten ingestion, you should inform your dentist of your celiac disease diagnosis to ensure that all polishing pastes, fluoride, and prescribed medications are gluten-free. When I was first diagnosed and I was going for my cleanings, that was back in the day before the dentists were more aware. They're very aware now, most of them, of the gluten that might be in some of the dental paste. I would come home and full-blown gluten symptoms for 2 or 3 days after I'd have to go to bed. I was so sick. I felt like I had the flu. Finally, I made the connection to the paste, it was the paste that they were using, and it did have gluten in it. I asked them to use a different one, which they did have, and the next time I had my cleaning, I didn't have any issues. But since I've been living in Central Florida, I haven't had any issues with my cleanings at all. So I think that the dentists are pretty much just, either the manufacturers are not putting gluten in the paste anymore, or the dentists are more aware, thankfully. Hopefully dentists are encountering a patient with bilateral and symmetrical dental enamel effects will add celiac disease to the list of possible causes, especially when there is a medical history suggestive of celiac disease, or if the patient has a first-degree relative with the condition. Okay, now let's talk about teeth whitening. If you have celiac disease, you can see my teeth are not gorgeous, right? They're not the beautiful white teeth that they were when I was in my 30s. And I've actually been a little self-conscious about them now that I've been making videos. Because, right now they look okay, but they're just a little bit grayish. And, I was wondering, is that the blueberries I eat for breakfast or what? But I talked to my dentist yesterday, and she said that if you are brushing with abrasive toothpaste throughout the years, she said that the enamel's only microns thick. And so you got to think about that. If you're brushing with like baking soda or other abrasive substances so that you can have beautiful white teeth, especially for your YouTube videos, by the time you're in your 50s, you're not going to have much enamel left to preserve. I was so glad she said that. Because I don't want tooth pain and cavities in my later years, so I would rather have the off-colored teeth that I have now. Let you poor fellow watchers deal with my off-colored teeth than have to have sensitive, darker colored teeth when I'm older. So she really recommended that you don't use tooth whitening toothpaste, especially on a regular basis, that you brush gently. And here's another thing, especially if you have celiac disease and you have gum issues, you need to brush gently with a soft brush. Brush for a longer amount of time to make sure that your teeth are getting clean and lots of good coverage, but don't brush hard because you'll get, oh, sorry about the oatmeal there. Oh, that was gross. I'm sorry. You'll get these receding gums right here because what happens is gum tissue does not repair itself. So your toothbrush, if you're brushing hard, especially with an abrasive toothbrush, it's actually literally ripping away the gum cells away, and then your gums start to recede. Even if you have healthy gums, they recede and they get down to where the roots are, and then your roots are exposed, and then you've got sensitive teeth. And the only way that I've been told by another dentist to fix that is to do gum grafts. And I don't know how they do that because, well, they do steal it from another part of your mouth, or I don't know where they get it. So brush with a soft brush. Brush for a long time with that soft brush to get good coverage. Get a mouth washers. It actually feels quite harsh, the mouth washers. You just got to do it with the right method and do it softly. Floss 2 or 3 times a day. If you have celiac disease, you need to floss more often. That's a message to myself. Water pick. Use a water pick, which is wonderful. And don't use tooth whitening toothpaste. You can use, let me take you on another journey. I'll show you the toothpaste that she's going to have me try. If I have it in here. I don't know if I have it in here. Oh. Nope. Where did I put it? I don't know where I put it. Anyway. The video's getting too long, so I'll put it in the comments below if I find it. I haven't tried it. I haven't checked to see what the ingredients are. I don't know if I'm going to be compatible with it yet, so I won't recommend it. Anyway, right now I'm just using regular old Colgate. So that is my report on how the celiac disease has related to my mouth, tooth, and gum health. And I hope that any tidbits that I shared with you that I got from Dr. Green and my dentist might be helpful in helping you to avoid having to have a lot of intervention in your older years. And chew your food so that you can have a healthy heart and eat lots of greens. Thank you for watching, and for your interest and any comments that you have, please put them in the comments. Give us any tidbits that you might have, or share any stories that you might have. Would be interested to read them. Thank you so much. Bye.